important and something that they're trying to learn. To do it more than once is a great thing. And one of the other things they do is they do once a year, and they funnel hundreds of students through 3 scenarios. And one of the scenarios that they do has to do with a medication error. So they have a scenario and someone inadvertently gave a medicine they didn't. And so there's a pharmacist, a physician, a nurse, that's the team, and they discuss what would you do? Who do you notify? How would you notify? How do you tell the patient? And it's a great discussion point. So they're an excellent resource. There's also ways in which to do interprofessional education and in the community as well. And we went to Haiti, and so a physician assistant, nutrition, and nursing as a group of us faculty and students went to Haiti and cared for patients in 5 different clinics. And that's a great way to understand what other healthcare professionals do, actually work alongside them. And this was a group of people that we worked with, just a great experience. At UMass, actually Eileen Stewart-Shore is the lead on this, and every year they go to Kenya, in the process of going to Kenya as well in order to care for people in need, and she takes a group of people with her. So I just wanted to give you some examples of interprofessional education. There's a million different ways to do it, but I think for each of our professions, nursing, physicians, any other healthcare professions, working together is so important, and then the goal is to maximize the health and well-being of patients. So, shukra. I hope I said that
right. Thank you very much for this interprofessional collaboration. We would like to have a different type of example can be applied, because usually you have mentioned that according to the family and the community needs. And if you have any questions for the 3 presentations, most welcome.
Dr. Abir Aisawi, Assistant Professor of Maternity Nursing. Actually, I want to thank all the presenters for the very fruitful presentation, which is really touching our work. But actually, it is not question, it's just an addition to Professor Carroll for the competencies that is needed to nurses. Nowadays, we are facing a lot of disaster crises all over the world. So one of the competencies that should be present for each nurse is to be able to deal with crisis, disaster, as well as risk management. Also, we should teach our student nurses how to deal with the challenging behavior for certain patients and patients with special needs, as well as to work under pressure and to cope with the stress. Thank you so much.
I would like to ask Dr. Osama about the big data analysis, because usually in our specialty and subspecialty also, we are dealing with nursing informatics. And the nursing informatics, it's a computers and software and information technology and nursing as specialty. So by this way, if we are going to involve this big data analysis, it will be under the umbrella of nursing informatics.
Yes. Thank you very much. In fact, all of the approaches dealing with data, but big data is a new trend which is completely different in its software, its structure, its hardware than the traditional what's called the relational database. So it is something different, but at the end it is dealing with data. But we have to be careful that we are going to need completely different structure, completely different software, completely different hardware and design for the system, which is completely different. But we have to guarantee in principle that we have big data. Okay?
Yes, يعني we'd like to ask you if you have a chance to be with us in our Faculty of Nursing to give lectures to the students about these big data.
To do what?
To be with us in the Faculty of Nursing
it is my
with
honor,
the students.
definitely. Thank you. It's my honor.
Because usually you have mentioned that you have a special software for these big data.
Yes, right.
But even the software can be updated, can be changed according to the different situation, the
Yes.
diversity of the data itself.
Yeah.
Okay.
Yes, sure.
No more? مش خلاص دكتورة زينب.
My name is Zainab Abdsalam. I'm a lecturer of psychiatric nursing. My question is for Professor Diana. You talked about interprofession, and from my opinion, my small broad perspective, if we're gonna have like a specialties that based between two professions, like for example, physical therapy and nursing. Now you have in the States, I know that you have ambulatory nurses and anesthetic nurses, and all of them have like a very unique, very unique characteristics. But how to integrate two different professions and maintain at the same time different or unique? Like I want to say not overlap between the profession of nursing and the profession of physiotherapist, so no one can say to me, you're doing the work of other profession. Thank you.
I think a big component of that is communication, and I think all it takes is simple as dialogue. And so if you're working with another professional, you want to work or you want to collaborate in order to address some patient, a specific patient or even a group of patients, it just takes dialogue. And let's discuss the patient and what's the uniqueness of the patient, and this is my focus, and can you work on that? And sometimes, honestly, it's just as simple as dialogue and a discussion. And we each have our own practice. So I'm licensed as a nurse, and I can't, although I have my PhD, my master's isn't in, I can't write scripts for patients, so I'm not able to do that. So if I'm working with a physician and, I'm working with a patient and their medications needs to change, it's a phone call to say, let's discuss it, and, maybe the pain's so bad we need pain management to come in, a whole host of things. But I know what my license is and what I can practice, and I wouldn't practice beyond my license. It's the same for any other specialty. They practice within their licensure, but it's to collaborating together, the communication piece, in order to maximize the health and well-being of that patient. I think it's a matter of you can do it with simulations, you can do it as case studies, you can do it as simple as case studies to discuss a specific case. It's helpful if you actually have the other discipline in the room, and they're usually very eager to do it. At home, I could call anybody and then say, yep, love to do it, happy to do it. And maybe if someone's given that chance, they would as well say would love to do it. And it's a matter of you have different disciplines within the room. You have a case study that can affect both disciplines or more than two disciplines. And you say, how would you approach this? And we did it recently. We have social work at home. I'm not sure if you have a social worker here. But the understanding people came away with what a social worker does and the depth and breadth of their practice was phenomenal. So you get to further understand what the other practice does and appreciate the other practice as well. It's just a great experience.
Of course, yeah. Thank you. I'm sorry, can I continue? But can't you see it like a challenge? Like this is the challenge that we're talking about, like to have a new specialties that based on interprofessions, and at the same time, the nurse who gonna study this gonna be challenged for doing the work of a nurse and doing the work, for example, a physiotherapist.
I'm going to answer that question because I think we agree. But I do have a grant with Macy's Foundation, which is known to provide funds for research in interprofessional. I came from a center before coming to UMass Boston. We had a medical school, we had a health center. We have the medical school, PT, OT, communication science disorders, athletic training. But we found one course that was common with the medical school nurses and all the other professions, which was the physical assessment. So we got all those students and we developed scenarios. All those students, they have to learn about physical assessment, how we got them in one simulation room, and then they had to interact with the patient from their own professional practice. So they learned a great deal. The difference between interprofessional education is big in terms of what we know, because we always work with other professions. That goes without saying. The issue is to learn with them so that they see the difference while they're developing their own professional behavior. So, did that help? But I will tell you, the worst part of this was that medical school students, they were on quarter basis, we were on semester. It was hell to get them on the same day to do
The same is here.
Right.
Thank you.
Right.
Thank you. Professor Dr. Sohair just invited Dr. Osama to come to our college and present something about the big data. Actually, I attended a very nice presentation for you about sustainability of accreditation and quality. I really also ask or give you more requests. And I really appreciate if you visit our college, because we are accredited college right now, to give us and to increase our information about how to maintain accreditation and quality in nursing education.
Definitely.
And you just gave us a promise.
It is definitely my pleasure and my honor. Definitely.
Okay. Thank you so much.
Yes.
Oh. Thank you for all, and now we will have the coffee break. Okay? Shall we go? For I think 30 minutes. 30 minutes, okay? And then another session will be at 3:30. لا مش 3:30.
فترة بريك يعني 5 دقايق بالظبط مش هنطول. يلا.
لو سمحتوا يا جماعه كل واحد معاه شنطته بعد اذنكم. كل واحد معاه شنطته عشان في ناس سايبه الشنط بتاعتها.